Hi, my name is RComas, and my presentation is based on my research that I did on attention deficit hyperactivity disorder, also known as ADHD. What is ADHD? ADHD is a commonly diagnosed mental disorder that causes children, teens, and even adults experience difficulties with attention, self-control, and self-esteem. There's It also causes behavior problems, learning disorder. Um, they have increase in injury, peer problems, and they even have a learning disorder and experience anxiety and depression. Some of the characteristics or signs of ADHD, it's divided into three different groups or within three different categories. The first category is inattention. They are easily distracted, doesn't follow directions, or finish their task or assignments. They don't appear to be listening, doesn't pay attention and makes careless mistakes, forgets about daily activities, has problems organizing daily tasks, doesn't like to do things that require sitting still, often loses things, and they tend to daydream. Now, in the hyperactivity, they under this category, they often squirms, fidgets, bounce around when sitting, doesn't stay seated. They have trouble working quietly. They're always moving, such as running, climbing, or doing things that they're not supposed to be doing when doing, a lesson or a lecture, or even in a home environment, such as like having dinner, for example. They talk excessively. They want to be heard. They want to be, it's all about me, me, me. They want to just blurt out. They're always on a go. Impulsivity, they have under this category, they have trouble waiting his and her turn. They blurt out answers because they want to be known in presence that, they are there, that, that's me, it's all about me. And they love to interrupt other while they're talking, or even a teacher or a parent, they want to constantly interrupt and get in the way. So further study in my study is how does ADHD affect the family? Well, it could affect the family in numerous ways because of the behavior development disturbance that they have. It causes a stressful situation for the whole family. Basically, some parents blame themselves, first of all, saying that they did something wrong or they must have done something to cause this in the child. But upon my research, this is just, like I had mentioned, this is a mental disorder that the child was born with. But there's disagreements between the parents, the fighting, the arguing because of they can't control the child, and mothers tend to experience the most stress because I believe not that I believe, it's what from my research is that they're overwhelmed when just trying to control their child's behavior. They tend to isolate themselves because they're embarrassed of the behavior that the child might create in front of the public. They experience depression. So it's just a difficult situation to affect that affects the family. It could even affects the siblings as well. Again, the behavior, the outgoing, the bursting, not doing things that they're not supposed to be doing. They're either fighting with their siblings, taking away their toys, taking away their books, going into their rooms, bothering them, and the sibling gets overwhelmed and with anxiety because they just can't handle their siblings, either their brothers or their sister, whether they're older or younger. They tend to have anxiety over the sibling's behavior. They resent the sibling over the amount of time because it's all about them. They feel neglected. They feel sad and they feel overlooked. Another effect that a child with ADHD is their education. Their education is very important, but they tend to have issues, like mentioned earlier, um, with following directions. They can't sit still. They're easily distracted. They don't seem to listen. Either they're always losing their homeworks, their jackets, their books. They tend to also have, poor grades or low grades. They don't do very well in school because of the difficulties in attention. Um, Furthermore, upon my research, parents with child with ADHD need to educate themselves and need to learn everything that they're out there, like the resources for ADHD. Once your child is diagnosed, there's therapy and counseling where the therapist helps the parents learn about the disability and the child too. And what's really important is letting the child know what they have and that it's okay, that you're going to work together to make this better. One of the suggestions that I read on my research is that a parent with a child with ADHD should create a routine, which is very important. They should get them organized to manage their distractions. Be clear and specific when you talk to your child. Make sure that they're understanding what you're expected of them and the way they're supposed to behave. And help your child to plan. Set goals and small rewards for them. Have siblings and extended family members be aware of this and explain to them what this is, what the ADHD is, and what to expect and how to work, and even incorporate the siblings into the plan so they could feel part of this and helping their siblings. Also, you need, the next step is to let the school know, especially with their teachers, and how to handle the child. I'm sure teachers are aware, but some new teachers might not have the experience. So it's always about communication, letting them know that your child has or has been diagnosed with ADHD. And if they're taking medication, let them know also that they're taking medication. Give them, have the teacher give positive reinforcement and attention. Allow time for movement and exercise, because that kind of helps them, be able to move freely. Short period of span, not all the time, but in the short period of span. Communicate with the parents is very important, and how the child is behavior, because you could keep in track to see what they're doing and how they're improving, and also with their grades. Keep a homework folder. That's the one way that you could communicate back and forth with the parents. And most important, this keep a routine. And this is really important. And you could even create one at home where it's a schedule with pictures that shows the student what they're going to do at time frames and all that. And this keeps them focused because they see what's going to happen throughout the day. So basically, this is my presentation on ADHD. I learned a lot from this experience. I have to admit that I have a 6-year-old granddaughter who was recently diagnosed with ADHD. And I'm very fortunate to have given this research opportunity, because now I'm going to be able to help her and my daughter set goals for my granddaughter Kayla. And I'm already seeing an improvement with her in her schoolwork and so forth. So I'm very grateful. I hope you enjoyed my presentation, and that's it. I hope you have a good day. Bye.